We're recording this, so go on.
Okay. Good morning, everybody. Just first want to start with, can I get a couple thumbs up in the chat if you can hear us? Can anybody hear us? Want to give us a yes in the chat? A thumbs up emoji.
Oh,
Yep, there we go. Okay, thank you. Okay, good morning. Welcome to our information session on health systems transformation. Just so everyone is aware, this session is being recorded. Today, we will not be recording the question period, just the presentation portion of the session. My name is Savannah Leary. I'm the project manager for health systems transformation. I will be your moderator for today's session. First and foremost, I want to thank everyone for taking the time out of your busy schedules to be here. Your interest and participation are crucial to the success of our mission to transform the health system in the Yukon. Before I hand it over to our presenters from the Health Transformation Advisory Committee, let me quickly outline how today's session is going to go. After they give you a presentation, they're going to respond to questions. So this is your opportunity to seek clarity and offer suggestions and engage with the HTAC members. So please put any questions that you have during the presentation into the chat, and we will read them out at the end. This way we can manage the questions efficiently and address as many as possible during our time together. So feel free to put them in there. We'll get to them during the question period. Should there be any questions we can't get to during our time together, we'll follow up with answers shortly. Now I'll turn the floor over to our presenters to introduce themselves. Thank you.
Christine?
No,
Okay.
gotta go around the circle. See, we're already not getting along here.
Yeah.
Sorry, come on now. Yeah.
We'll cut that part from the recording. Hi, good morning, everybody. Thanks, as Savannah said, thanks very much for taking the time to join us. My name is Paul Payne. I'm the Assistant Deputy Minister of Corporate Services with the Department of Health and Social Services. Tiffany Boyd, who's our Deputy Minister, is one of the co-chairs of HTAC. She wasn't able to make this meeting, so I'm here to support in her absence.
Hi, good morning, everyone. I'm Stephen Mills, and I'm a member of the Yukon First Nation, and I'm also on the Health Transformation Advisory Committee and as a co-chair of that committee.
Morning, everyone. My name is Jason Bilski. I am CEO with Yukon Hospitals and also a member of the Health Transformation Advisory Committee.
And hiding behind this chair over here. Come on now. Yeah.
Lean in.
Come on, yeah.
Morning, everyone. I'm Christine McTavish. I'm the Director of Health with Council of Yukon First Nations.
And
Come on, yeah.
Hi, everyone. Jenny Imbo, Director of Legislation and Partnerships for HFS.
There you go.
so we do have a presentation that we'll walk through today. Hopefully it will take about 30 minutes or so, leave lots of time for questions. And between myself, Stephen, and Jason will be switching out, so you don't have to hear us all talk for the whole time. And I think I have the first slide if you wanted to go forward. This slide just talks a little bit about our journey in healthcare transformation and some of the important milestones. And folks might have heard through various news releases or emails or other channels some of these types of activities, but just going, I guess, way back now, starting in 2017, at the time there was a financial advisory panel that was commissioned to take a look at Yukon's health and social services system. And so in November of 2017, health spending was emphasized in the Yukon Financial Advisory Panel final report to illustrate some of the growing pressures of our aging population within the territory. And a careful review of the Yukon health system and monitoring of health spending on an ongoing basis was recommended. And out of that, an independent expert panel was appointed to lead the comprehensive review of the health system, and that started in 2018. Between 2018 and 2020, as part of the independent panel's review of the health and social services system, over 920 Yukon voices shared their stories, concerns, recommendations to improve healthcare programming and social services in the territory. And those voices included experience, Staff were engaged as part of that, community members, et cetera. So it was quite a comprehensive review. In May of 2020, the Putting People First report, which was the result of that comprehensive view, was released. And in August of 2020, that same year, the Yukon government, it did endorse all 76 recommendations that were outlined in the Putting People First report. Flash forward to spring of 2022, the initial health system transformation team was formalized, started with a couple of folks in the department looking at all of the Putting People First recommendations. And then in the summer of 2023, there was the establishment of the Chiefs Committee on Health and the Health Transformation Advisory Committee, which we'll talk about in quite a bit more detail. And that was to really support the efforts of transforming our health system, ensuring that we had participation and collaboration and support from Yukon First Nations as part of this transformation efforts. And since the summer, the Health Transformation Advisory Committee has been working together to discuss some of the important policy and legislative issues and learning from other health systems. And we'll talk a little bit more about some of that important work that's happened to get us to the point that we're at today. So as folks may be aware, on March 11th, the government tabled the Health Authority Act, which is a really important milestone, but just one step in the overall health transformation journey. So that process is happening right now. It's actually, we'll be back up in the House again today, continuing debate on the bill. And we are hoping that as part of the Legislative Assembly in the spring, this sitting, that bill will pass. Assuming it does pass, some of the further looking work is probably in the fall or winter of 2024, or potentially into 2025, establishing that initial board of directors. In the Health Authority Act, we are referring to the Health Authority by the Indigenous name of Shäw Kwä'ã, which means it is all good or it's all well in Southern Shoshone. We'll talk a lot more about that as part of the later slide, but we would expect in the fall of 2024 for that board to be established. And then a transition period, which will likely last several years to really do that work of operationalizing the health authority and getting it ready to essentially be able to start delivering services. We know that's complex work. We'll talk quite a bit more about that. And it will, like I said, take likely several years for that work to progress.
So I just want to speak a bit about the governance and what's been occurring over the last many months. Ultimately, like the legislation that was introduced, it's Yukon government legislation. It's up to the cabinet to determine what's in it, and it's up to the legislature to determine how it moves through the Legislative Assembly and whether it's passed, as Paul had mentioned. Yukon government established a ministerial subcommittee, and then they also, of course, the Minister of Health and Social Services, Tracy Ann McPhee, of course, is the lead on this one. It was decided early on that, and part of the Putting People First, the spirit of Putting People First was this was going to be a collaborative approach. And so the decision then was to establish a Chiefs Committee on Health and who would work alongside the minister in development of this legislation and some of the next steps I'm going to speak about. So the Chiefs Committee on Health is chaired by Chief Pauline Frost, the Yukon First Nation. Also includes Chief Barb Joe from Champagne-Asia First Nation. It includes Deputy Chief Darla Jean Lindstrom from the Carcross-Tagish First Nation, and included also Councillor Tanya Silver Fox from Little Salmon Carmacks First Nation. So they work with the minister. They decided to establish a Health Transformation Advisory Committee to lead the development of the legislation and the consultations and discussions going on. There were 6 people on this committee. The committee still has those 6. They're on the First Nations appointed 3. There was myself and as a co-chair. Also Diane Strand, who we're really lucky that she is part of it because she was also part of the expert panel on Putting People First. So she's been on this journey for a number of years towards this health transformation. And also Doris Bill, who some of you may have worked with. She was chief for many years of the Kwanlin Dun First Nation and heavily involved in health and social issues in the Whitehorse area. On the government side, we have my colleague here, Jason, who was also on the Health Transformation Advisory Committee, along with Tiffany Boyd as the co-chair, and Ed Van Randen, who's Deputy Minister of Health and Social, responsible for social services. So what we've done now is, if you look at under the 4 columns, Shäw Kwä'ã, that's the establishment of this health authority. It's one of the recommendations under putting people first. It's an important recommendation. And that was our focus of work since last summer. Where we are also now, as this moves through, and I think it will pass, the Legislative Assembly, is where we get into the really exciting work. And this is a health service design. And we're going to talk about some of the things that we've seen and some options that are out there. But this is where we actually get to look at, build on what we're doing well, to course correct on things that we're struggling with. And also, how do we kind of look at both healthcare delivery in Whitehorse and where there's hospitals in Watson Lake and Dawson, but also in rural communities. And we're going to talk a bit later in the presentation about how we, what Shäw Kwä'ã is going to look like, what health and social will look like. But we're gonna want people on the front lines. We want people with both the experience of delivering programs and even your frustrations of delivering these programs. But we also want to learn from those that have a lived experience in receiving these important programs. And what can we do in order to really transform our healthcare system? Then we also have to look at what does health and social look like after this, because it will be a different department. And finally, there's 76 recommendations that are putting people first. And we have to start to continue working with Yukon Government, First Nations, everyone, in implementing these important recommendations as well.
So the next slide here, we want to talk a little bit about what we're aiming for. What are the areas of improvement that we're looking at? What are the areas that we're focusing on? The original Putting People First report identified something called the quadruple aim, 4 different areas that are internationally recognized aims for health system improvement. Over time, we've actually added one and modified one of the aims, and that's what you see up on the slide today. So these are what we would consider to be our guideposts or North Star. These are directions that we're heading in and what we're really looking for in health system transformation. So enhancing the patient experience, improving staff experience, improving population health, increasing the value of investment in the health system. That's a conscious decision that one actually has been modified away from cost and going towards value, a value-based system for what we're looking at. And then lastly, the one that was added was advancing health equity, a very important one within our context. So to this point in this presentation, we've basically taken you through the journey of all the steps that have happened probably since about 2017, so over the last 7 years. Certainly, Stephen has given you the governance framework, the framework that we'll work under through health system transformation. And then lastly, what we're aiming for. Now a little bit about what is a health authority and why a health authority, and dip our toes a little bit into what that looks like. So a health authority is an arm's length organization that delivers day-to-day health services and some social services. Shäw Kwä'ã will be created through legislation, which is being worked on right now. And when that legislation passes, it'll be mostly funded by Yukon government. But it'll be separate from government as a non-agent. And health authorities are typically led by boards of directors and a chief executive officer, so a senior leadership team. On the right-hand side of the slide, you'll see examples of health authorities. You may be aware of other health authorities, or you may even be aware of these ones. Across Canada, health authorities aren't necessarily new. Pretty much every jurisdiction, except maybe Nunavut, has gone through some form of health transformation and has health authorities that exist. So it's not new or novel in that context. But what is new and novel is our piece of legislation. And if Tiffany were here, she would say that it is truly groundbreaking and world-class in terms of advancement in legislation for health authority. And something that I always like to point out that's very unique in our legislation that's being proposed is the co-governance aspect with Yukon First Nations. And that means various levels of consensus and agreement within the legislation that's being proposed, and very important, again, within the context of Yukon.
during the development of the Putting People First report, there was a lot of jurisdictional scans done by the expert committee. We as a Health Transformation Advisory Committee also went down. We looked in BC at the BC First Nations Health Authority to kind of learn a bit about their structure. A couple things that were different at that time that they were mostly delivering non-insured type health benefits, and that didn't quite fit with the model that we were looking at, or what our task was with regards to the Yukon. We also went to Alaska and spent quite a bit of time with the South Central Foundation. And that was, I think, for all of us here, was a bit of this aha moment about, okay, this, you can see transformation in action. And there were a few things that we learned from over there. And one was that you need to, at times, kind of turn the healthcare system a bit over on its head and build on its strengths. But also what they did there was they really kind of refocused everything around what they call the customer owner, and as we may call a patient or client. And then they built the services around them through integrated care teams. And you'll see a picture on the right there of we went in there in Alaska, or into Anchorage, and we went to another outlying community and saw these integrated care teams. And what they had was, the primary care, the provider, or the physician, registered nurse, dietitians, behavioral health consultants, or mental wellness workers, their schedulers. They even had a pharmacist just off to the side. And in Anchorage, this room, I think there were about 12 of these teams in one longer room. And so it really took away the hierarchy. Instead was to build an integrated care team around the customer client. And what it did do was a number of things. First of all, they delivered their program to not only in Anchorage and some larger communities. They delivered to 70,000 individuals, but they also delivered to about 55 more remote communities. So the context fits quite a bit better with the Yukon. What they were able to do when they had these integrated care teams working with them with these customer clients was get better outcomes. And so their focus was a lot on primary care, and they had significant decreases in ER visits. They had an exceptional, they had 97% satisfaction rate among customer owners. And they had a 95% success or satisfaction rate amongst those that work in the system. And that's just absolutely unheard of. And when we were traveling around Alaska or in Anchorage, and we'd go out for dinner, we would go and talk to individuals. You go into a store, people were wondering what we were doing there. We told them we were going to the South Central to look at the model. And so many people said, hey, I'm a customer owner, or I work in it. And they spoke so positively about how this different approach and this integrated approach to care has had such a difference in their lives of how, their relationship with the entire healthcare system. And they even, they have a cultural healing component to traditional doctors, but it's built into the system, not sort of off to the side. And so it was a very different way to deliver care. And I envision it with my First Nation, for example, with the Vantakwichin, that having this type of integration could very much change the health experience and the journey of a person from Old Crow. Whether it's primary care or acute care, it could really change your journey. So we're not talking about taking the South Central and the Nuka model and just dropping it into the Yukon. What we see is that we can learn from it and take the best elements of it and fit it into a Yukon context. And yeah, it was truly an exciting experience to see a different type of healthcare system in operation. With regards to, next slide, please. Yeah, thank you. With regards to the legislation, so we're going to start to dig a bit more into elements of the legislation here. We talk about a health authority, we talk about South Central Foundation. The legislation that's currently before the Legislative Assembly isn't going to solve the issues, but it's definitely going to build up. It creates the conditions in which the problems can be more easily solvable. So the legislation is really, we started to lay the foundation with the Putting People First report. We're framing this up with the legislation as well, but now we really got to add the details to complete this transformation or the construction of this. So, you know, and this is where we really, again, I'll go back, and where I get really excited about is the system design. How are we going to design a new way of delivering a healthcare that is both provides a high level of satisfaction to the people that work in it and much better health outcomes for all Yukoners.
So high-performing health systems require clear and purposeful roles and responsibilities of all components of that system. So the legislation and the approach to health transformation, as we've already mentioned, will basically transfer or move most of the health system delivery and integration to Shäw Kwä'ą, the health authority. Just as important, at the same time, the ministry or the Department of Health and Social Services will shift its focus towards strategic stewardship of the health system and address broader social determinants. So as you can see in the diagram, we would say that on the top half, strategic, the what and the why. So that essentially is the ministry, the minister, and many, and the focus there will be on essentially legislation, regulation, policy, finance issues, surveillance and oversight, and basically setting strategy for the entire health system. The bottom half that you see, the who and the how, Shäw Kwä'ą, essentially that's the concentration of service delivery. Again, the who and the how of what happens. Earlier, I may have mentioned things like separate and arm's length. Separate and arm's length in this case doesn't mean that the two will be separate and never shall meet. What it means, and hopefully what you take away from this slide, is role clarity. Role clarity for minister, Yukon First Nations, ministry, and health authority. And with that role clarity, if you do get a chance to look at the legislation, you'll see that there's several levels of accountability and role clarity throughout for all those parties, defining what and how things happen. And what that means to me is a better opportunity for a seamless journey, healthcare for patients, clients, and families, and also a much more efficient and effective environment for providers and healthcare workers to work within.
So you might be wondering a little bit more about what this would look like in practice. And so this slide talks about the potential division of functions and services between Shäw Kwä'ą and the department. And I'll just reiterate the word potential. So there's some more work obviously to be done before this gets finalized. But this slide outlines some of the functions, programs, and services that may be delivered by Shäw Kwä'ã, and then what would be part of the Department of Health and Social Services in the future. This slide really is based on the work that was done as part of the Putting People First review and report. That report provided recommendations on which programs and services are well suited to be run by a health authority. And those include functions like hospital services, long-term care, mental wellness and substance use, and emergency medical services. And the report also recommended that the department would remain responsible for delivery of some social services, such as family and children services, income support, and then as well, as Jason mentioned, some of the strategy, policy, and other elements. As I mentioned, this is just the potential based on the work that was done as part of Putting People First in that comprehensive view. The intention is to continue discussions through both the health services design work that Stephen talked about, as well as other work with our partners to determine sort of what this might look like in the future. So these may change over time.
So just with regards to some of the unique aspects of Shäw Kwä'ã, I mean, if you're looking at the legislation and you want to do a read of it, or even a partial read, take a look at maybe the preamble, some of the objectives and purposes provisions. It'll give you a really good idea as to what the whole intent of the legislation and the creation of Shäw Kwä'ã is all about. There's a few other things that I just wanted to highlight, is that the board of directors, first of all, the success of Shäw Kwä'ã is based on, I mean, you're part of the success. We need the people that are working in the system to both embrace it and also look at and help us in the transformation, because that's going to ultimately decide if Shäw Kwä'ã is successful. We also need a board of directors, and the decision was to go with a 7-person board of directors with that's competency based. We also wanted to reflect the rural urban sort of makeup of Yukon, as well as reflect gender and other aspects of what makes Yukon great. And so that's first of all on the board. The Minister or First Nations will be appointing 3 members to the board. Minister will appoint 3 members plus the chair. Minister and the First Nations committees will work together and make take all efforts to reach consensus on the board, because we really need that board to work really well together. Other aspects of Shäw Kwä'ã is around cultural safety. So the health authority itself will be required to develop a broad cultural safety framework. And that cultural safety framework is to strive to address the power imbalances that are inherent in the delivery of health and social services and create an environment that's free of racism and discrimination. The bill does require the board to take the training and also to establish the training programs for all of its employees as well. And there's elements of cultural safety throughout the legislation. So again, if you're looking through the legislation, you will really see the importance of cultural safety as part of Shäw Kwä'ã's creation. With regards to Yukon First Nations, again, this is really unique to other health authorities across our country, is that there are there are over 25 areas of the legislation where First Nations will be part of what is needed to be done. For example, the Shäw Kwä'ã in developing a strategic plan needs to work with First Nations to develop in development of the strategic plan. When the minister and the department develop a 10-year Yukon health and wellness strategy or plan, that also requires the input of First Nations. So First Nations will be integral as part of developing what the operations, the procedures, how Shäw Kwä'ã will actually move forward.
So the next slide, we wanted to talk a little bit about impacts to employees. And, you know, we recognize with change, there's some uncertainty, and that can be scary. And you know, folks can feel uncertain about what might happen to them. And we wanted to provide a bit of information around that. So our minister has said in the House that the transition to a health authority is not a cost saving or workforce reduction exercise. I think that's really important for us to just keep reiterating that. We are, as a health system, whether you work for Health and Social Services or for the Yukon Hospital Corporation, we need you, frankly. Like, we're in a health human resources crisis, and our frontline providers are our most valuable asset. And so we want to do everything we can in our power to both improve the care experience for patients without sacrificing any employee working conditions, pay, or benefits. The well-being of our workforce and ensuring that staff are supported is at the forefront of our work. And is really essential to our transformation goals. Preserving and matching pay, benefits, and pensions are essential to those goals. And this commitment is being said here. It's been said publicly by our minister on a number of different occasions in the House, as well as in her article in the White Horse Star. And it's something that I think we just can't say enough, that is a strong commitment we have. Under the Canada Labour Code, there's something called successor rights. And those rights exist for all bargaining unit employees. And so essentially what that means is, unless agreed to otherwise, Shäw Kwä'ã will inherit the existing collective agreements and will take over those employer responsibilities under those. As I said before, we recognize that this change can bring some uncertainty and discomfort, but we feel strongly the benefits to Yukoners and those who work in the system will be absolutely critical in moving our health system forward. We know that staff have questions about these changes, what they mean for them. And we are still very much at early stages of this work, but there's a commitment from both Health and Social Services, Yukon Hospital Corporation, as well as working with our partners to ensure that we continue to communicate with folks about the changes, what it might mean for them, any impacts. We do have an email address as well, so if you have any questions or concerns, regardless of what organization you work for, healthtransformation@yukon.ca. We're working really closely with the Hospital Corporation to make sure that we answer those questions and provide feedback. So I would encourage folks, if they have questions, to either bring them up during this session or via email. And we also have a few other channels too, which we'll talk about at the last slide.
Okay, so the slide says if the framework bill passes. We like to say when it passes. But when it does pass the legislative assembly, the health authority will have a transition period. And we've spoken about this earlier, to establish itself and prepare for operations. It is proposed that only certain sections of the act will come into force if it is, when it is passed to create the health authority. An initial board of directors will be appointed, and this will be, again, as mentioned earlier, through best efforts to reach consensus between the minister and Yukon First Nations. And a chief executive officer will be appointed to set up the health authority, including developing organizational policy and processes. And it's expected that this will take 2 to 3 years. During this time, the Yukon Hospital Corporation and its board will continue to operate normally and will work with the health authority to support the transition. Once the health authority is ready to begin service delivery, the remainder of the act will come into force. You'll see the rescinding of the Hospital Act, and the hospitals will bring the hospitals under the health authority. And also then concurrently, the Yukon government's will begin to explore transferring some of the other programs and services as discussed earlier, whether it's community health centers, long-term care, EMS, and other operations. So, yeah, and again, that time period is a bit fluid. We want this to succeed, and so we may be ready to operate a little bit sooner, or it might take a little bit longer for the transfer of certain program areas. Yeah.
So as I mentioned earlier, really wanting feedback from staff. So we do have a SharePoint that is set up for staff. I believe we have one for Hospital Corporation, one for HSS. So hopefully folks have the link. If they don't, please post it in the chat and we'll make sure you get the link regardless of what organization you work for. Really critical that we do get your feedback. It helps us inform the work that we do, better understand concerns. And there are a couple of ways. As I mentioned before, we have our email, healthtransformation@yukon.ca, and we'll do our best to respond as quickly as possible. We also, if you have questions and you don't feel comfortable attributing yourself to them and you want to do that anonymously, we do have an anonymous form that is set up. So you can either scan the QR code that's currently on the screen, or if you click on the link, and we'll post the link in the chat for the Zoom as well, and follow the instructions to submit those questions anonymously. I think that's it for us. And as I said, we have opportunity now for questions, a small group. I guess, Savannah, maybe I'll hand it over to you to.
Yeah, for sure. I'm gonna stop our sharing. I'm gonna stop the recording now.